I'll follow you.
Hello, this is Howard Owens with the Batavian, and today we are talking with Dr. Jacob Dominik from the Sleep Insight Center. It's it'll be an interesting conversation, I think, because we'll talk a little bit about what the Sleep Insight Center does and what they offer, but Washington Post, others have reported about, in these stressful times, how it's disrupting people's sleep, so maybe we'll learn a little bit about how we can all sleep better. So, Dr. Dominik, thank you for joining us today.
Yeah, thank you for having me. It's great to be here, Howard. Thank you.
So first of all, just fill us in, on the Sleep Insight Center and what you do there.
Sure. Well, we're simply a medical practice, just like any office, like your primary care doctor or your cardiologist or your neurologist. But we take care of people with sleep disorders, and there's many different sleep disorders, and we handle all of them. The common things that people have are trouble falling or staying asleep, which is insomnia, but another common problem is sleep apnea, which is breathing problems during sleep. But there's also less common sleep problems. We handle all of them. So it's just another specialty medical practice that you can come get taken care of at.
So typically, would you have patients, in for sleep studies, or has that always been something that you do telemedicine-wise? And then also, anything changed, and what are you doing now to help people?
Sure. Well, so, sleep studies have been around for some time, and very often, patients would see their primary care doctor and they'd be concerned about some sleep issue, and their primary care doctor would order a sleep study. What's sort of different, especially locally, about how we operate and why we have an office there is we try to take care of patients. We don't just perform tests, but we will see patients, and based on the sleep problems they have and the story they tell us and our examination of them, then determine if testing is required. Very often in sleep disorders, testing is not necessarily required. If testing is required, what type of test? And then see the patients back and help them manage these problems over a period of time. Very often sleep disorders are things that we manage, not necessarily cure, so it's an ongoing relationship with your doctor. Now, what's changed now is that, like a lot of other practices, we're trying to avoid contact with people and sort of distance ourselves as well. So currently we are not seeing patients in the office other than for emergencies, although there are really very few sleep emergencies. So practically we're really not seeing patients in the office. And we're not doing all of the testing that we normally do, but we're doing a lot of things without much difference. So first of all, sleep medicine is very amenable to telemedicine. We can get a lot of the information that we need from people simply from seeing them and talking to them and maybe just seeing a couple of things through the camera. Second of all, there are different types of sleep studies. There are sleep studies where some people will spend the night at a sleep center, and that's not really happening anymore, again, except in very critical situations. But we've always done home sleep apnea testing for a certain condition called sleep apnea, and that's a device that people would take home and perform a test at home. We're doing that just like we have before. The only difference is now we will mail that device to a patient as opposed to having them take it with them in the office after their visit. And beyond that time, certain patients, a lot of patients that we see use CPAP machines to treat breathing problems in sleep. And getting people started on that sort of treatment is also a service that we're offering through telemedicine. So not a whole lot has changed. We're still able to really manage most of our patients, certainly well enough to get us through this time.
Wrong key here. So, Doctor, a couple of things came up while you're talking I thought I'd ask about. First of all, just kind of throw you a curveball here from what we discussed previously, is you mentioned CPAP machines, and the governor's talked about BiPAP machines and how those might treat people. And I think a lot of people don't understand what a BiPAP machine is. They don't even know what a CPAP machine is. So maybe some of the people watching this might want to know what those two devices are.
Sure, absolutely. So a common problem that that we see patients for is a problem called obstructive sleep apnea. And that essentially is some people's throat will close off during sleep and cause difficulty breathing. A CPAP machine, what that device does is, people think of it as a breathing machine. A CPAP machine doesn't really help you breathe. It doesn't give you oxygen. All that a CPAP machine does, it's a compressor, takes air from the room and pressurizes that air. So when you're breathing through a CPAP machine, you're breathing just regular air, but at a higher pressure. What ends up happening then is the pressure of the air in your throat is stronger than the pressure of your throat closing, and the air just sort of holds your throat open. Kind of like what stents do in your heart vessel for someone who has a stent put in for heart disease. And what the C in a CPAP means continuous. And what that means is the pressure of the air that you breathe in is the same when you breathe in and when you breathe out. How that's different from a BiPAP machine, the bi stands for bilevel. And all that means in terms of compared to CPAP that's different is that there are two different air pressures. There's a higher air pressure the machine gives when you breathe in and a lower air pressure when you breathe out. Just like a CPAP machine, a BiPAP machine can keep your throat open with the air pressure and is used to treat sleep apnea. But because of that difference between the air pressures, BiPAP machines can also help someone breathe, help move the air out of their lungs a bit better when that's a problem in other conditions. And so it's also used for other problems beyond just sleep apnea.
Okay, thank you. I think one of the things I read when I was when the subject first came up about CPAP machines, BiPAP machines, is that the BiPAP is better at not, like if an infected person is using a CPAP machine, really what they're doing is possibly, according to what I read, and correct me if I'm wrong, is possibly then they're spreading that virus in the room. That the way the air works is that it's circulating the virus as part of the air, and the BiPAP can help decrease that.
I don't know that there would be. So there is a concern about something called aerosolization, which is the fancy word for what you just said, both with pressurized air therapy. I haven't heard anything or don't know that would be any different with CPAP compared to BiPAP. They're much more similar than they are different, and I think that would probably be a similar risk for both devices. Now that doesn't mean that someone who has sleep apnea and has concerns about COVID-19 should stop using their treatment. But that's one of the reasons, for example, that we have stopped doing sleep studies in the sleep lab, so as not to expose potentially staff to something like that.
Okay, good. The other thing is maybe we should talk a little bit about, I think a lot of times people may not realize that they have a sleep issue. They just think that they accept the tiredness or whatever is normal. What are your recommendations for how somebody can recognize that maybe they need to get a sleep study or find out a little bit more about how well they're sleeping?
Sure, that's a great question. Sleep disorders are extremely common, and it's hard to know what's normal. Sleep disorders don't sort of develop in a way where, or almost never develop in a way where you're fine and then suddenly you wake up the next day and you've got a sleep disorder. These are things that sort of creep up on you little by little, and it's hard to appreciate a change day to day. And so it's hard to, you can get used to your reality pretty quickly, and can be hard for people to appreciate that they don't feel normal when it's just the way you feel all the time. That's just your reality. So common, I do find patients tell me a lot, well, yeah, no, I'm fine. I can stay awake when I'm busy and doing stuff. But if I sit down, then I'm falling asleep and I feel tired. Well, so that's a good measure of it. Anybody can usually stay awake when they're busy, interactive, running around doing stuff and interacting with other people. But if you're well rested and the quality of your sleep is good and you're getting enough sleep, you should also be able to sit there, do nothing, and stare at the wall and stay awake. So a good measure of are you too sleepy is, when you're not engaged, do you feel really tired or sleepy? Another thing that can be a clue is if you have trouble falling or staying asleep, and then generally, obviously, if you feel tired and sleepy. If bed partners notice there's something wrong with your sleep, there's no one real thing to watch out for, but I think the threshold for talking about it should be low. Often I see patients and they wait to the point where their wife is completely fed up with them, or they almost had a car accident because they fell asleep driving, and then they decide they need to do something. And people have had symptoms and problems for many, many years. So people tend to wait longer than they should. Anything that's a concern is worth at least talking about.
Well, so that's all good advice. I wasn't going to talk about myself too much, but
go for it.
But for just, I think I want to communicate to people the importance of this, because I was really resistant to the idea that I had any trouble sleeping and that I was fine and that I needed a CPAP. And when I got one, it changed my life and the amount of energy I had every day. And I think that's why I asked the question previously. I think a lot of times people don't realize exactly what's going on, it's easy to think that you're just sleeping normal.
Yeah, you're exactly right. How do you know what normal is when you just feel the way you feel every day, right? It's hard to perceive that. And um, you know, sometimes patients have obvious symptoms of sleep disorders. But I also often see patients who just kind of go, yeah, I'm fine. I don't know why I'm here. My wife's bugging me. I came in so she'd stop bothering me. And then we find out that they have some problem. And if we treat it successfully, I do have patients often say to me, wow, this is amazing. I don't know how abnormal I felt until I no longer felt that way. So there is a perception issue there. And it's even possible for people to have significant sleep disorders and be asymptomatic and have no symptoms. But it's not just about symptoms. Sleep disorders like sleep apnea, for example, can cause other health problems, even if they don't bother you too much, even if you feel like you sleep well and you don't feel too tired.
That's great. And I appreciate that. And certainly for me, it was, I didn't understand how I really felt until I felt that way.
That's great. It's great. I'm glad you're doing well.
So one of the things we really wanted to talk about was, this is a very stressful time for a lot of people. People are out of work. People's, their businesses are struggling. They have family members who are sick or could be exposed to this, and they're worried about that. I mean, there's multiple things to worry about every day right now, and we're hearing that is affecting people's sleep. So how does stress affect sleep, and maybe kind of what can people do about it to help themselves sleep better?
Sure. Insomnia, trouble falling or staying asleep, is probably the most common medical problem that exists. And certainly anything that raises your stress levels or a difficult time in our lives, whether it's work problems, worries about your health, financial worries, the loss of a loved one, all of those things can manifest as difficulty or trouble sleeping. For a lot of people, kind of all those things are happening right now simultaneously. So it can be very difficult. And so difficulty sleeping right now is not unexpected for a lot of people. But it doesn't mean it has to happen. And there's certainly things that people can do to at least limit the effects of this stuff on their sleep. One thing that's very common is that for a lot of people, it's very important to have a regular and consistent sleep and wake schedule and pattern. And for a lot of people, what the main driver of that is their job and their work schedule. They go to bed at a certain time because they got to wake up at a certain time, and they wake up at that time because they got to get to work. And so that really helps to keep people on track. Currently, there are a lot of people who are out of work or furloughed or working less. And one thing that can possibly contribute to trouble sleeping is just being able to sort of drift away from your regular and consistent sleep and wake pattern. So one thing that I would suggest to people is try to remain really consistent with respect to the time you go to sleep, the time you wake up, similar hours on weekdays and weekends or days off and weekends, because allowing yourself to drift and be a little bit irregular if work's not forcing you to be that way can help promote developing more trouble sleeping. Another thing that certainly can help to fall asleep and maybe sleep a bit more deeply is just some regular exercise. One maybe slight silver lining of this whole situation is if exercise can be difficult for people to do just because of the time constraints that they have with work and family life. Maybe there's a little bit of more free time available now, so maybe a little bit of regular exercise can help both with falling asleep and just to sort of relieve some of the stress and anxiety. Another thing that can be really helpful to help maintain good sleep is, especially now where we're stuck at home and there's really nothing to do but be on the computer or the phone or the internet the whole time. And it's easy to fall in this tendency of consistently being plugged in and connected to devices right up until the moment you want to fall asleep. Sometimes it can be hard for your brain isn't really like a computer or a phone. It doesn't really turn off with a switch. So suddenly turning everything off and expecting to fall asleep immediately can be difficult. And these devices can affect you in a way that can make it more difficult to fall asleep or fall asleep more quickly. So having a scheduled time, like say an hour and a half before your bedtime, just to unplug, dim the lights, and having a sort of calming wind down time before bed can also really be helpful. Those are some simple things people can do that doesn't involve taking medications that can help them sleep better. When you sleep better, your mood is better, you're able to handle stress better, and all kind of works together. It's very important for a time like this.
So what you're saying, keep a regular schedule. Now is not the time to stay up till 2 a.m. binge watching Tiger King.
Yeah, exactly. Well, I only had 7 episodes of that, so that'll take a while. But I have no problem with someone staying up till 2 a.m. Some people are night owls. Mm-hmm. What I just want is to make sure that people are consistent and get enough sleep. So if you want to stay up till 2 a.m. and you can sleep till 10, you can do that every night, go for it. But consistency and getting enough sleep is the key.
Do you want to talk at all about the science behind getting a certain number of hours sleep? There are people out there that believe 6 is enough. We often hear that 8, but I haven't heard other numbers. Kind of what do you think the science shows on how much sleep we need for good mental hygiene and all that?
Yeah, sure. So like anything, right? It's a bit of a range, and there is some variability in normal from person to person. What's considered to be as a normal range for an adult is between about 7 to 9 hours, and most people will be in the 7.5 to 8 hour range. Now, there are some people who just tend to need more sleep than others, and there are some people who can get away with less sleep. But I think 7 hours would be a good minimum to aim for. There are sort of big population studies that do show that there is increased mortality for people who chronically get too little sleep. So meaning they just don't tend to live as long, and that risk starts to go up when people are consistently getting less than 6 hours, really less than 4 hours. 7 hours is probably a good sweet spot to aim as a minimum, but everyone's different. You got to kind of know yourself. There are some people out there in the world who are really sort of short sleepers, who really, they're fine on 5 hours. But that is not that common. And I'd say probably the majority of people who think that that's the case are actually people who are just getting too little sleep. What is clearly shown in science and in studies is that we subjectively, as human beings, very quickly adapt to chronic sleep deprivation, but we don't objectively, which is sort of the worst possible combination. You're impaired, but you think you're fine. So I think a lot of people say, yeah, I'm fine. I only need 5 hours. I've gotten used to it. You can't really get used to it. You just think you are. And, things like reaction times, memory, all those sort of things continue to get worse with chronic sleep deprivation. So, I'd say 7 would be a good minimum people should aim for. But, that's a challenge for all of us, getting enough sleep, right? Life gets in the way, work gets in the way, family. It's a hard balance.
I can totally relate to that. Doing what we do, it's very hard to keep regular hours. So. I want to touch on one more thing because we really should have maybe hit on it when we were talking about sleep apnea and sleep disorders. There are physical health concerns, right? And people may not be aware that how much sleep and getting a good night's sleep plays into their other health issues. So maybe we should educate people on that a bit.
So you're absolutely right. So specifically with respect to sleep apnea, it's known that can have a lot of health consequences if untreated. When you stop breathing during sleep, obviously if you stop breathing, it's possible for your oxygen levels to drop, and this has an effect on your heart rate and blood pressure. And over time, this puts you at risk for other medical problems and some of the common stuff that affects people in our country. So sleep apnea definitely causes high blood pressure and makes that more difficult to treat. It's associated with a lot of different heart problems, just heart disease in general, and heart rhythm problems like AFib. It's a risk factor for having a stroke. It's associated with risk for things like diabetes, and even associated with stuff like erectile dysfunction in men and glaucoma and gout and a lot of other medical problems. So, sleep is really important. Now, why do we sleep? No one really knows for sure, and it's probably a lot of different reasons. Sleep has a role to play in memory and in the proper function of the immune system, and in probably cleaning your brain of the gunk that develops throughout the day, and many other things. But the way to think about it is, kind of most living things sleep to some degree. It's something that's probably very, very important on a sort of molecular level. And if it wasn't that important, we wouldn't need so much of it, essentially. So ultimately, I think if you're depriving yourself of sleep, the way I look at it is you're kind of like, you're sort of putting it on the credit card, and you're gonna have to pay it off with interest later.
I think it's all very good stuff. One more question, if you don't mind, is smart devices now have an Apple Watch. Phones can track sleep. Any thoughts on like the usefulness or reliability? I just look at it to see how many hours sleep I might have gotten each night. But any thoughts on those devices?
Yeah, absolutely. So these are it's interesting. Technology is always changing, and overall, it's a positive thing. Even when you look at like CPAP machines themselves, back in the day, they never had humidifiers, and that was a problem for people. Then they got humidifiers, and now we can get the data through the internet. So it's generally beneficial for sure. Now, a lot of these sleep tracker devices, how they work is they're an accelerometer, so they track movements and maybe a couple other things like your heart rate and stuff, and use algorithms to try to determine if you're awake or if you're asleep and what stage of sleep you're in. It's kind of hard to know some of them. There's some studies, but a lot of these companies, they use, proprietary algorithms, and they won't let you study them and take them apart and stuff. But it's useful. It's data, and it's useful. This is the way I look at them. If you're a person who's wearing one of these sleep tracking devices, I think they're most useful comparing you to you over time. So, if you're wearing your Apple Watch, telling you you're sleeping great, and then maybe like a year later it says your sleep's a little more disrupted, and especially if that seems to correlate to some symptoms you're having, like you're getting more sleepy, you're falling asleep, you're taking naps, that would sort of make sense to me. In terms of the machine telling you you're getting this much of this stage of sleep, this much of this stage of sleep, that can be a little more variable, and it's hard to know what that means. But it's information, and over time, these things will get more reliable and better. And I think we're going to get to a point where those devices will probably be used to help us actually diagnose some sleep disorders in the future. They're not there yet, though.
Good. I really appreciate your time, Doctor. We took up quite a bit of it.
No problem.
So thank you.
We're here. We're still seeing patients, Batavia and all across, Western New York. So feel free to reach out to us, and we can do some telemedicine.
Great, thank you. Was there any other topics you wanted to hit on that we might have missed?
No, I think that was a good. I think that was a good example of the type of stuff we deal with, and we look forward to seeing our patients in the office, in the virtual office.
That's great. Well, it was great meeting you virtually, Doctor. I thought it was a very fascinating discussion. Thank you for your time.
Yeah, thank you. I'm glad you're doing well with the treatment. Nice to meet you.
Good to meet you.
Thank you. So bye-bye.
Bye-bye. So this is Howard Owens with the Batavian Publisher. We just talked to Dr. Jacob Dominik, Sleep Insight Center here in Batavia. And I think it's some interesting stuff. If you missed it, go back and watch it. And tomorrow we are going to have a couple more live stream interviews going. Just working on finalizing the schedule on that. So you all have a good evening and get a good night's sleep.